Arthritis got you down. Well, this is Dr. Mark Petrapoli. I'm an orthopedic surgeon, and I actually treat more people without surgery than I do with surgery. And so when people come to see me, they usually want to know what arthritis is, and they want to know how they can, improve their pain without having surgery. So I always try to treat people without surgery first and explain to them what arthritis is. So arthritis is nothing more than the cartilage on the end of the bone. If you ever look at the white on the end of a chicken bone and look at that, that's called the articular cartilage. And that's kind of what we have on the end of all our bones. And our bones come together and form joints, and the cartilage on the end of the bone is kind of like the tread on a tire. When that wears down, that's what arthritis is, pure and simple. Now that does cause pain, and arthritis is one of the most common causes of pain in the world, and it's one of the most common things that I see. So we always try not to do surgery if possible. And I did a little Google search and came up with the top 3 non-operative treatments for arthritis pain. And we're going to go through those, and I'm going to give you my take on them because I don't know if I necessarily agree with those top 3 right there. But the number 1 was cortisone injections. Now, what are cortisone injections? First of all, people get scared when they hear injection because that does require putting a needle into the joint. But cortisone is an anti-inflammatory. It's a natural hormone, natural anti-inflammatory. Our bodies make it. However, drug companies make it in the lab, pharmaceutical companies make it in factories, and it's something that we inject into a joint to decrease inflammation. So it is very good for decreasing inflammation. However, it's not very good for anything else. It's kind of like a Band-Aid. And it's kind of last century's technology. We have much, much better ways of treating arthritis nowadays. Some of the reasons why cortisone is bad, and I don't like to use it, I rarely use it anymore, is because number 1, if you do a cortisone shot, if you do have to have a surgery, we're trying to prevent surgery, but if you do need a surgery, you actually have a higher risk of getting an infection if you had that shot within a couple of months. Another thing is if you're a diabetic, it can make your blood sugar go up. And I don't know if anybody out there has heard the news, but it was all over. You got NBC here, you got US News, you got the Daily Mail, that's in the UK, you got CNN. There were 2 studies that came out last year that talked about how patients who got cortisone actually developed and worsened arthritis than the patients who didn't get cortisone or the patients who got gel shots. And we'll talk about the gel shots here in a second. So cortisone actually increased their arthritis, even though it helped their pain for a short period of time, but it was temporary. So it's not really dealing with the root problem. It's just masking it, and it's kind of like a Band-Aid. And turns out it probably causes the arthritis to get worse sooner. So I don't use it. So I would go down with the number 1 reason on the internet. Number 2 for non-operative was hyaluronic acid injections, and physical therapy was up there as well. So we'll talk about both those. Hyaluronic acid injections are the quote-unquote gel shots that people hear about. So hyaluronic acid is the stuff that's inside our joints. Our joints have fluid, lubricating fluid in them, and hyaluronic acid is the main component of that lubricating fluid. So there are companies that make artificial joint fluid shots that, yes, we stick a needle injected into the joint, for example, the knee, and it basically thickens up the fluid. But what it also does is the body absorbs it and it stimulates the joint to produce better fluid. So it tends to last longer than a cortisone shot. It still only lasts about 6 months. It's only FDA approved for knees. We do use it off-label for shoulders, hips, other joints, but it's temporary and it's not really treating the root problem. Things like PRP, which we'll do another talk on at some point, platelet-rich plasma, bone marrow aspirate, concentrate, BMAC, which is another treatment that has stem cells and other cells that help the stem cells in it. We'll talk about those. Those actually help treat the root problem. And there are probably 37 studies out there that show that PRP works for arthritis and works better than cortisone and the gel injections. The gel injections can be 1 shot up to 5 shots. And again, you can get them every 6 months, but they tend to be temporary and they don't treat the root cause of the problem. As far as physical therapy goes, I do think physical therapy is an extremely useful tool. Basically, there are some things that the physical therapists are trying to do. A lot of times there's swelling in the joint, so they're trying to get the swelling down. They're trying to get the inflammation down. They have certain techniques that can do that. They're working on range of motion. A lot of people, when they have arthritis, their joint gets stiff. So the physical therapists work on mobility, getting that range of motion back. And then the most important thing is strengthening the muscles around the joint, because your muscles are your main shock absorbers, okay? What your muscles don't absorb, then the joint has to absorb. And the joint has that cartilage on the end of the bone, which is kind of like slow compression rubber. That's kind of like the tread on a tire. And as that wears down, more and more force gets transmitted to the bone underneath. Bone has millions of pressure sensitive nerve fibers, and it tends to hurt. So the stronger you can make your muscle, the less force is going to go across that joint and the less pain there's going to be. So the problem with, quote, standard physical therapy is the way the insurance companies want it done is they don't give the physical therapist enough time. It's not the physical therapist's fault. It's not the patient's fault. It's the insurance company's fault. They only give maybe 20, 30 minutes. And if it's a knee, for example, they're really only going to pay for treatment of the knee, when a lot of times the hip, the ankle, the core, other areas of the body, even the other extremity, are causing issues that are flaring up, either the arthritis in the knee or causing it in the first place. So the therapists usually aren't given enough time to really deal with all the other things that are going on. And that's why they kind of rush patients through. So standard physical therapy, it's great if they have the time, but if they don't have the time, it's really not going to do as good of a job as if they had more time to really treat not just the affected joint, but the joints above, below, and surrounding it. So I would say that out of these top three things here, we don't really ever do cortisone shots. We do a lot more PRP and BMAC, which again, we'll do another video on at some point. The hyaluronic acid injections, we used to use them a lot more, but the insurance companies are not even approving those a lot of times nowadays. And there's plenty of studies that show that PRP works better than hyaluronic acid injections anyway. So we rarely use those either. And then the physical therapy, we do use physical therapy, and we have our own physical therapy department, but we also have something called VFit, Victory Fitness, which is a 1 hour total body fitness session. So it's not just concentrating on the knee, for example, it's concentrating on the entire body, and it's a full hour. And that is more of a medicalized fitness program that really treats the patient as a whole patient and not just as one body part. And we can talk more about that at some point in the future. I hope you learned that from those top three right there, 2 out of 3 we really don't use anymore. And as I talked about a little bit earlier in the video, what we do suggest and what we do use is PRP and BMAC a lot more. And we have videos linked down below to learn more about those.